Pop quiz. Number 23. Which action should you delegate to the LPN LVN for the care of a patient with hypothyroidism? Select all that apply. All right, guys. How do we treat select all that apply questions? We treat them as true or false. By itself, individually, if the answer stands, true, and if it doesn't, false. Let's go. 1. Assessing and recording the rate and depth of respirations. True. Absolutely, you can delegate that to an LPN. Now, here's where you guys mess up. You see the word assess and you think, no, LPNs can't assess. Of course they can assess. I want you to think about this for a second. LPNs give medications. They give routine medications, right? Right. They give antihypertensive medications, right? Right. So do you think they would give an antihypertensive medication without taking the patient's blood pressure first? Of course they can assess. What they can't do is in-depth assessments. So an assessment when the patient's just been admitted, or an assessment when the patient's about to be discharged. They can't do in-depth assessments. They can't do in-depth teaching, but absolutely they can do assessment teaching. So 1, correct. 2, auscultating lung sounds every 4 hours. Of course. Absolutely. 3, creating an individualized nursing care plan for the patient. False. LPNs can't make care plans. The RN is responsible for making the care plan and changing the care plan. Now, what the LPN can do is follow the care plan, but they can't create it. RNs are responsible for making the care plans. RNs are responsible for the in-depth assessment for admissions, discharge, central lines, giving blood. That's another video. Remind me, I make a video on delegation. But when it comes to care plans, absolutely not. So we're not going to keep that one. Next, administering sedation medications every 4 hours. False. Well, Professor D, why is it false? You just said LPNs can give meds. Of course they can. But why would we give, look at what type of medication we're giving, a sedative. Why would we give a sedative to a patient that has hypothyroidism, where their blood pressure may already be too low, their heart rate may already be too low, their respirations may already be too low? Are we trying to kill the patients? Absolutely not. The LPN's not going to give a sedative to that patient, and neither will you, the RN. Let's keep going. 5, checking blood pressure, heart rate, respirations every 4 hours. Now, although absolutely you can give that to the LPN, but why would you not give that to a UAP? UAPs are allowed to report and record. It says nothing about assessing. It says nothing about listening to the lung sounds, because remember, they haven't been trained to know the difference between clear lung sounds versus wheezing, right? UAPs can record and report, and that's number 5. So false. We're going to give that to a UAP. And 6, reminding the patient to report any episodes of chest discomfort or pain. Absolutely. The RN does the initial teaching, and the LPN comes behind them and remind them. Absolutely.